Hello, my name is Carlton Nicholson, and I'm currently enrolled in the Psychiatric Mental Health Nurse Practitioner Program here at Eastern Kentucky University. This is Class 892, and this is a poster project presentation. So one of the topics that I would like to focus on today is the enhancement of antipsychotic medication adherence among those who are diagnosed with schizophrenia. The clinical nursing problem that we face is the task of keeping those that are diagnosed with schizophrenia on a proper medication adherence regimen is a challenge from a clinical nursing standpoint. The problem results in a multitude of rehospitalizations, relapse, and exacerbation of schizophrenia, and a myriad of psychosocial setbacks for the patients, as well as the support system for the patients. So the background of this problem is that poor antipsychotic medication adherence is prevalent in those that are diagnosed with schizophrenia. Many of these patients have very little support systems from family, friends, and sometimes the community. Antipsychotic medication non-adherence is also linked to increased aggressive incidents, more suicides, emotional and social burdens, and increased financial costs among this population. So the method that was used to measure the adherence among these patients was the utilization of motivational interviewing. This is a client-centered directive method, and it involves principles of cognitive behavior therapy. And what it does, it enhances the intrinsic motivation to change. So what was done was that we chose 150 patients, and we split it into two groups. We split one into the motivational interviewing group, and then the other 75 and the treatment as usual group. The adherence rating scale was used to measure the adherence of these patients, and this was on a scale of 1 to 5, 1 being poor, 5 being excellent. So these patients were rated pre, intra, and during, which is during, and also post motivational interviewing treatment. So patients received questionnaires. Also, outpatient records helped in the final rating. And this overall interviewing technique is an alternative to pill counting, urine test, as well as serum tests. So the outcome of this was that motivational interviewing treatment was effective in enhancing antipsychotic medication adherence. Motivational interviewing creates a sense of ownership in terms of facilitating self-care as an outpatient. Patients who received motivational interviewing felt more empowered with the motivational interviewing treatment. Schizophrenia relapse decreased by 50% over a 6-month period with the motivational interviewing treatment. So the implications and conclusions of this is that poor antipsychotic medication adherence is vital to positive well-being of those that are diagnosed with schizophrenia. Results show that motivational interviewing was significantly more effective on female patients, younger patients, and those with shorter illness durations. So future utilization of motivational interviewing method should target more of the above demographics. However, modifications of this method should be ventured into in an effort to increase the effectiveness among more demographics. I would be remiss if I did not express great gratitude to the participants that allowed for this study to be possible. Also, a special thanks to Drs. Corley and Owens for your continued guidance and steadfast support. To the stakeholders who funded this project, many thanks to you. Lastly, to my fellow discussion group members, thank you for your input, support, and for adding a spirit of teamwork throughout this endeavor. Thank you.